So fun fact about me is that I'm a guru, or a classical Indian dance teacher, and I basically attained guru status after 15 to 20 years of training, and I did my final 3-hour performance, and that's how I attained guru status. So my friends often joke around and they call me Guru Doctor. One quote that I live by is, "Life is a marathon, not a sprint." And I think that quote really inspires me in times of challenge or bumps in the road. It reminds me that you need to have larger perspective on things, and scaling back and seeing the bigger picture really helps my focus in putting things into perspective. And I think this also helps with fertility patients, and there's lots of challenges and nuances in fertility care. And I try and help my patients get the confidence and the understanding and education to help them see the larger picture as they're really going through their own struggles. So I grew up in Philadelphia, Pennsylvania. For better or worse, that makes me a Philadelphia sports fan for life. I've basically been in the Northeast my entire life. I did my undergraduate in Pennsylvania at Muhlenberg College. I then did my medical school at Drexel University College of Medicine. After that, I did my residency and fellowship trainings in New York City, so I've been there for the past 7 years. I recently moved with my family, my husband and my young son, to South Florida. We're very excited about the move and looking forward to all the fun and all the new challenges that we're going to have here. I think one unique thing is really my ability to connect with patients. I think one of the biggest roles I have is to help educate and empower women as they make their own decisions about their fertility care. And I think it's very important that they're equipped with the knowledge and the confidence to do so. So in addition to seeing my role as providing medical care, I think it's really important to be able to connect with those patients and providing them what they need to help them with success. I would describe my bedside manner as empathic. I think it's important to understand and be able to walk in someone's shoes. So I think in order to do that, you have to get to know the person and the story behind what they're telling you. And I think sometimes it's sort of the iceberg theory where only 10% is necessarily said in the beginning. And I think the other 90% is really getting to know someone deeper. And that happens over time in building patient rapport and having a good relationship. And so I think being able to understand and connect with patients and make them feel comfortable is something I really pride myself on, and I'm excited to share that here at Conceptions. So I was really drawn to OBGYN and fertility care, mostly because I'm really passionate about inclusive family building for all. I think as a new mom myself, I've actually really experienced firsthand and now can appreciate the drive to want to build a family. And I think that, coupled with my medical knowledge of understanding the complex medical issues along with the nuances and the psychosocial components that go along with infertility. And I think that combination has really fueled me to want to help women in that way and help people in general build their own families. One experience that I think has really touched me is actually during COVID. And I think when in New York City, a lot of fertility care halted for about 3 to 4 months. And I think it was then that you really saw the drive and the desire for people to want to build their families. And so that 3 to 4 month gap of being able to coach someone through, talk to them about advice, help them through of the psychosocial components, the anxiety around building a family in a time of urgency and really unknown and anxiety, I think was a really challenging but unique opportunity as a part of my training. And I will certainly take away so many of those moments and remember the anxieties in general about fertility care and hope to use that lens to help my patients further. What excites me most about joining Conceptions is really that the focus here is on the patient. And for my practice, I really believe that the patient should be at the forefront in terms of patient care, in terms of education, in terms of resources, in terms of medical complexities and first level care here and attention. And so I feel that the practices here at Conceptions are really built towards that and really support that. And that is the ethos that Dr. Hernandez-Ray has carried through and something that makes me very excited about joining.